Hey everyone, I have the pleasure of being joined by Dr. Kyle Matsel. We did several courses for MedBridge on returning to full performance after ACL reconstruction, and we get a lot of questions. So I thought we'd take this opportunity to answer one of those questions today. One of the things that always gets brought up is we talk about needing to see the patient for an extended period of time, usually a year post-operatively. And the immediate question that is on everyone's mind: how do you navigate limited insurance visits? Meaning sometimes they only have 20 visits a year or 12 or 6. What does that look like? Do you actually deal with that? And how do you deal with it?
Oh, that's a great question, Phil. We encounter that all the time. It just seems like anymore nowadays, people have less and less PT visits and are being squeezed just a little bit tighter, a little bit more. And so being able to have a plan in place to navigate that is so important. Really, it starts at the beginning. The most successful patients that I found navigating this model is you just be upfront with them and say, this process is going to take some time. We need to make sure that we have navigated all your biomarkers, all your risk factors, but also given your body time to heal and really let that to solidify in before we're getting you back to, full return to sport or discharge. So just setting the stage early, managing those expectations, if you will, of this is going to be a 9-12 month process. And then tailoring your treatment plan based off that. This is, if someone only has 25 visits a year, this is not someone that I'm going to see 3 times a week in that first month. I'm going to manage their visits, make sure they're hitting their milestones and those biomarkers. And then if I need to see them a little bit less, maybe that's every 2 weeks, maybe that's every few weeks, to manage those visits throughout that course of that time frame, then I'm certainly going to do that. But I think PTs get in sometimes a little bit of a quandary. They use all these visits, 15, 20 visits up front, and then they don't have any left, and then they just have to discharge the patient. So I think just being a little bit more judicious with your visits early is the big key.
Yeah, I think the 2 points that you made there are essential. Number one, we have to communicate very clearly, quickly with the patient. This is what we need. And I always start with optimal and ideal. This is what we're going to look at. It's amazing how we burn through visits early on. I think the most important visits are probably those first 2 weeks post-op, where that is where I'm seeing the person maybe twice a week. But then quickly after that, it is only 1 time a week, and I am setting them up on a very solid program that they're going to be doing in the gym. And this is regardless of their insurance visits. But if you, like you said, you look at 3 times a week for 4 weeks, that's 12 visits right there in a month. And I don't know that we needed to use those right then. If you start with twice a week for 2 weeks, and then once a week for 4 weeks, we're only at 8 visits at that point in time. And then we're going to go once every 2 weeks, for a couple times, and then once a month after that. And you suddenly, 20 visits last you a year. Now, again, you have to have a compliant patient and all that, but that's also part of the education process. But we're going to really dial in that. And then the other thing I'd like to say is I think you need to consider the letting the patient make the decision on, hey, this is what it's going to cost after insurance has run out, that, it's going to be X dollars per visit. And, after those 20 visits, we are going to need 6 more, and really making it clear. And we have to meet these milestones in order for me to know that you are rehabilitated and you are back to where you should be. So I really am big on, I want to change people's perspective on, don't let the insurance tail wag the dog on this one. These are people's lives we have in our hands, and we need to make those, a shared decision-making model together. Any other thoughts on that?
Yeah, no, I think you hit again another great couple points there. Just, I mean, gym memberships are so important, and they're very, very cheap and affordable. I mean, you can get gym memberships now for $10, $15 a month, and have access to the equipment that you need to maintain the strength and continue making gains. So I think talking with the patients early about gym memberships, getting them on a program that even if you're not seeing them every other week, or even if you're only seeing them once a month, they're on a very solid program that they can be working on in the gym with those expectations in mind. So cash visits, gym memberships, these are all great ways to get around those insurance barriers sometimes.
Absolutely. I think we limit ourselves with our belief about how much we're worth as rehabilitation providers, and I think we need to kind of stop that. And just like, these are what our services cost, and this is what we need to do to get you your best outcome. So thanks for answering that question. I sure appreciate it. If you haven't been to the MedBridge courses, I hope you join us there for some great discussion.